Well, market mechanisms are being introduced in primary care, or they have been introduced since 2008. It's somewhat difficult to say anything about the immediate results because it differs a lot in different parts of the country. But if you look at Stockholm, for instance, you have both large groups of companies that are now entering the market, and you have small providers who are doing the same. And the GP doctor system is being included in this as well. And that's one big push that the politicians have made recently, because they want to expand the family doctor system to the greatest extent possible. And in order to achieve more capacity, they wanted to introduce competition to have more private contractors come in. I think one interesting difference that I've experienced anyway is that in Sweden we talk a lot about choice. It's at least politicians tend to like to talk about choice rather than competition, because it's more controversial, I suppose, and it's also something that the public really do enjoy. In the latest poll you saw that 75% of the Swedes that were asked whether they think that choice is good in primary care, 75% said that they thought so. It was only 2% who felt that this was a bad thing. So it's not controversial, it's not dangerous for a politician to talk about choice, whereas when you start talking about competition, it immediately becomes more controversial, because then you will have to defend also the fact that you can make money out of helping people in their basic health needs. To me, that's not very controversial, but I realize that for the public it is. And that seems to be the case in the UK as well, that obviously this is a domain that have previously been preconceived as sort of a natural public monopoly. And now that this is changing, of course it challenges a lot of the preconditions for the political debate, and that's an important and different thing. I think it's been better than expected, I have to say. There were a lot of fears in the beginning that all mayhem would break loose if you allow this kind of development. But if you look at the academic research and studies that have been made, it actually seems that it has worked out pretty well, especially in Stockholm as well, which is possibly the most interesting county council to study, because it's the one that has gone furthest in introducing competition. And none of the fears about inequality getting worse, about costs exploding, about old people not getting the help they need because they take too long at the doctors, for instance, none of these fears have actually come true. So even if we're still in the beginning of this development, obviously, we've only had it for a few years, I think that there is much to say that this has been a correct decision to begin with. Obviously, they will need to be developed, and I think the legal thinking is not always there properly, that you open up new markets and then you don't reform them as if they were markets afterwards. And that causes problems. But I think that's also because this is so new. We don't have a tradition of doing things this way, and it would be strange if everything worked perfectly from the beginning. I think the most important factor now is that you can choose both whether you would like to register with a big company who's got a group of private providers, and they will do things exactly the same way regardless of where you are. And for a lot of people this is great comfort. I mean, it's a little bit like in the public sector. It's a sort of, the large scale variety of things. But what is good, I think, is that you now have a more varied market where you also have smaller private providers, family doctors, where staff has just got fed up with how things were in the old public organizations and started their own businesses. And they tend to be more experimental and adding profile to an extent that the larger companies don't really do to the same extent. Although I think the larger companies have been very helpful in the fact that they are very efficient. I mean, they're very good at finding ways of delivering care that is of a good quality, but at a lower cost. So you do need to have both these kinds of actors on the market to have it work properly.